So you wake up with a weird feeling. You go for an ultrasound scan. And then you're told that you have ingrowing tumors in your uterus. And supposedly, they also confirm that indeed, that is fibroids. And for so long, you've been wondering why you cannot conceive, why you're having painful and prolonged menstrual periods, why your pelvic area is always paining, why you're having lower back pain, why generally you're having a very unexplainable abdominal discomfort, unexplainable bleeding, constipation, random piercing pains, fevers, and so many more. So if the masses are not so big, they tell you go back home and do watchful waiting. Sit and see what happens. Or maybe you're given an alternative. Maybe they can just remove your whole uterus, but you still want to give birth to more children. Or they tell you the only option is surgery. But again, there are 9 chances out of 10 that even after surgery, the fibroids will occur. If the pain is too much, welcome to pain relief pills. So you are generally confused. You do not know what to do. How do I get rid of these fibroids? But what exactly are these fibroids? Well, if you ask, the only explanation that science has so far, they are non-cancerous tumors or masses that grow inside or outside your uterus. And yes, fibroids continue to grow in size because they are alive and they are made up of muscle cells and connective tissues. These things come in all shapes, types, and forms. We have intramural fibroids, submucosal fibroids, pedunculated fibroids, and so many. The honest truth is science currently has no significant actual cause of what brings about these masses. But speculations say that perhaps genetics, having a family lineage where probably your grandmother or your mother suffered from fibroids, exposes you to higher chance and risk of also getting the fibroids. Age-related factors. The moment you clock 25 and above for women, chances are high you are at a risk of fibroids. Prolonged misuse and use of contraceptives. And that is a lot in Uganda. Hormonal imbalances and so many more. But before you lose hope, let me introduce to you STC30. Honestly speaking, I haven't seen any treatment that gives permanent curity from fibroids like STC30.